Good morning friends, this is Major Dr. Pravin, and today I would like to give you a nice tip on implant practice management. You know, in my life when I started doing implants, I was not using any formal softwares to handle the stocks, or I was not having a proper system to maintain what is the amount of inventory I am holding, what is the implant I am holding, how much quantity I am having, and where in which patients I am using those implants. Say for example, there are doctors who do implants on per order basis. They just take one implant whenever they want. They order an implant, and whenever they finish the case for further implants, they will order in the company and the next 10. But there are doctors who already who are practicing implants in a everyday basis. They need to have solid systems for stocking the implants, for ordering the implants, and the abutments, the components, and all these things, because these are the problems we face every day in our implant practice. Especially I focus on everyday implant practice. In my clinic we have almost cases every alternative day or every day. So there were a lot of issues in my life when I started doing implant practice. So first point I want to convey in this video to all the viewers is you should have a solid system of maintaining your records. Okay, how many implants are coming, so that has to be kept in a file. The invoices has to be kept in a file. If you are not buying through invoice, you have to have a register, a ledger, which maintains the implant brand name, quantity, the size, and everything. Okay, the second point I want to tell you is, after you place an implant, it is always better to write for which patient that implant was being delivered. This is the particular implant. Say for example, you have used say Edin implant or Straumann implant. This implant, this size for this patient has been delivered on this date. So which doctor has done it, and all the details should be there. So this is the second thing you have to note down. Why? Because sometimes at certain cases you may be thinking, what is the ideal size I can do. Sometimes you would have used implant size or something in a particular patient. So this book will definitely give you an idea. Okay, for this type of cases, this implant size is generally good. So you can order that particular implant. Say for example, anterior implant cases, you may be thinking, what could be the size I can use. With experience we get it, but beginners may get a doubt every time. You would be thinking, what is the ideal size for my implant. Okay, third point I want to tell you is, there are many things which happens in an individual practitioner. Okay, suppose you are a single practitioner who are doing general practice and also implant practice. What happens here is, if you don't have a dedicated staff to take care of your implant stuff, what happens is it becomes a mess. So you don't know what is happening, when the order came, when the lab components were given. So I'm having a book called Implant Storybook. The Implant Storybook will have the stories of everything. Suppose we write it literally like a story. Okay, on 24th of January, say on 4th of February, we placed an implant on this particular patient. So for this particular patient, when I was using the implant, this is the trouble I faced. So with this trouble, what happened was, I managed like this, then I used the other implant, then the problem got solved, or then I tried the other implant also, the problem didn't get solved. So immediately we did like this, we spoke to the lab. So this is called Implant Storybook. If you write this story, what happens is, after some days or some years, when you turn back, you will know what is the journey you have gone through. You will be really glad to see that. So you will also know what is the conception. Like I have used Edin implant, I have used Genesis implant, I have used Ostem implants. Like that you can write. So you can also write this particular order came on so and so date in our clinic, received by so and so staff, and this staff has kept this particular stock in that particular place. So when you write like this, so you will know exactly what is happening. So with the date being marked very clearly. So dear friends, one thing I just want you to understand is, if you don't have this, what will happen? If you don't have this, it becomes very cumbersome, and maintaining your implant practice will be very, very difficult, because you may lose some implants. The staff might dispose an unused implant And if you are doing everything on your own, what will happen? Your production time will decrease. The valuable time you spend with your patient is the only time which you earn your revenue and profit. So if you are fighting with your staff, if you are fighting with your own self in understanding what has happened, what did I do, if you are not organized properly like this, so you will get into a lot of trouble. So this is why practice management is very, very important. So kindly understand this, and this storybook will be very helpful. Because this also will feel, after you write the story, you will feel really nice to see what has happened in your implant journey. So dear friends, if you like this video, please share this video, and if you like this video, please subscribe to the channel so that regular updates can be given for all the practice management ideas. Thank you and God bless you.